Hi there, good afternoon. Dr. Ken Ferguson here. I'm here today once again with Alicia Miller.
Hello.
So today what we're going to be discussing for this Facebook Live video is bone health. As a doctor of chiropractic in a chiropractic clinic, we obviously look to the skeletal system to help solve a lot of the muscle and joint problems that our patients are dealing with. But today what we're going to be focusing on is the nutritional component to maintaining good, adequate bone health in order for our patients to be active and healthy and hopefully as pain-free as possible. But before we get into it too much further, don't forget to like and share the video, comment if you have any additional information to share about your own experiences. That would be helpful to put out there to the community. But before we get into the information today, just for anybody who might not be familiar with you here at the clinic, Alicia, can you help them understand a little bit about yourself and about the practice here?
Sure. So I'm Alicia Miller. I'm certified in holistic nutrition, yoga, and meditation, and I offer those services here at the clinic. So if people are interested in any of that, they can call or ask or book an appointment.
Okay. So can you then help us understand how and why nutrition is important for bone health and why that's important for the people watching?
Right. So there's several reasons, and you can either come at this at a prevention or, once somebody has a condition. So there is different ways to come at this, but there's two main reasons nutrition is really important for bone health. One, of course, our food has a lot of our vitamins and minerals that we need for our bones. Our bones contain 12 minerals and 64 trace minerals, so we get a lot of that from our food. And vitamins and minerals, vitamin K and vitamin D, although vitamin D is also from the sun, but we do get some from our food.
Okay.
Those are also really important for bones. The other thing is, of course, we did the video on acid alkaline, so people can look back and check that out.
Yeah, we did that last 2 weeks ago.
Yeah.
Yep.
Yeah, so the Facebook Live, you guys can go check that out. The acid alkaline really impacts the bones because the body uses calcium as neutralizing. It's a very alkaline mineral. So if we're on the acidic side, our body uses that calcium or other minerals to alkalize the blood stream especially. So they can check out the acid alkaline video and learn a little bit more about that too.
So just to delve into that a little further, so when it's stripping that into that bone into the bloodstream, that's lowering bone quality.
Exactly.
Right?
Yeah, it's taking the calcium from the bones into the bloodstream to neutralize it. And then sometimes that calcium can either get directed to the cardiovascular or bone spurs, other places, if it's not reabsorbed properly.
Okay. All right. So that makes a lot of sense. And again, check out that previous Facebook Live video to understand a little bit about acid alkaline balance and how that affects our body's tissues. Now, when it comes to food sources to maintain bone health, to get that good mineral and vitamin content, can you elaborate on that some more?
Sure. So just like the acid alkaline video, greens are really amazing. They're really high in a lot of our minerals especially. And I always recommend good quality sources as well as varying cooked and raw. So some people do better on cooked and some people do better on raw, but if we kind of do a little bit of each, then we get vitamins and minerals from both sources.
And you don't get bored with your food.
Yeah, exactly. Good quality sodium as well, like not anything with MSG or just the sodium chloride mix, which is like regular table salt, not that, but either Himalayan salt or Celtic salt is really high in minerals, and they're minerals that are really important for the body. So, of course, salt makes our foods taste better, so putting a little bit on that really helps. I also really like sesame seeds. They're really, really high in calcium. They're the highest absorbable form of calcium. So I like tahini. You can put some on a dressing or something and add it to your salad. So those are some options for people. All
right, and those are some food sources to help get good, adequate mineral and vitamin content to help maintain bone health. And again, if you're just joining in on the video midway, I'm Dr. Ken Ferguson. This is Alicia Miller. We're from Oliver Chiropractic Wellness Clinic. And what we're discussing today is nutritional factors to consider in order to maintain good quality bone health, because without a good quality skeleton, we're pretty much just flapping in the wind, right? So now when it comes to the practical steps, what are some steps people can take to go about improving and maintaining their bone health?
Sure. So first, like I said, eating those good quality sources of vitamins, minerals from our food. So some of the foods I just suggested. And then overall having a healthy diet and maybe watching that acid alkaline or understanding that balance is important. Secondly, making sure you're absorbing your food properly. That's a big thing. A lot of people, especially if they have stomach acid imbalances, aren't absorbing the minerals properly. So to look at their vitamins their any imbalances that they might have in digestion.
Okay.
And then thirdly, if they have any kind of hormonal imbalances, that can also affect the way our body absorbs calcium. So thyroid especially and some estrogen imbalances can cause different issues. So just to look at those different things, that's a good place to start.
For various health conditions, health concerns, the world of supplements is huge. Okay? Yes. So when it comes to bone health and supplementation, can you discuss that a little bit further to help our viewers understand when supplementation is appropriate, maybe what type of supplements to consider to maintain bone health?
Sure. So like you said, it's a big world and there's lots of different supplements. I'm mostly going to focus on just a mineral complex. Because I do see a lot of people who will individually supplement calcium, and I actually don't recommend that.
And why is that?
Because again, calcium sometimes isn't absorbed properly, and if it's not absorbed properly, they've done a lot of studies now showing that it is a leading factor in cardiovascular diseases. Okay. So it's better to take it in a mineral complex, because then you're getting all of those minerals and vitamins that are being absorbed effectively together, because they do need each other a little bit.
Kind of like when you're eating food, right?
Yeah, exactly.
Right? There's a lot of different things in that one single bite, right?
Yeah.
So
if they're gonna if somebody's gonna supplement with something, I recommend either a complex, a good quality complex, and or you can also do like a green supplement. That's also really helpful. Okay. So alfalfa, wheatgrass, spirulina, chlorella, there's a whole bunch.
There's a whole bunch, and that's why some guidance is helpful, and maybe this kind of leads into our next question. How can you go about helping someone who needs that guidance about maintaining or improving their bone health or diet in general?
Yeah, so a lot of the factors we talked about today I can help people with, and helping to find any of those imbalances. So like I was saying, if they have a digestive issue or a hormonal imbalance, I can help support them with that, or help even identify some of the issues. Yeah. So that's a good place, as well as just everybody's individualized, right? So I do individualize my plan for that person with a meal plan and everything that they're going to need in that package. Perfect, yep. So that's a big way I can help somebody.
Right, because sometimes we need a little bit of an extra helping hand, have some information so you're armed with some tools, so that when you're facing a difficult choice, or or a pressure situation, or you're hungry, right? We don't necessarily think about the best food choices when we're hungry. Having that information can go a long way for you to create a positive snowball effect to affect your health and nutrition, right? So I hope this information was helpful. Again, today we were discussing bone health from a nutritional perspective, and to review, we discussed supplementations, right? You want to take calcium in a single form, you want to get your supplements in a complex form, right? Correct. And if you need some help, give our office a call and discuss things with Alicia. She's here to offer holistic nutritional consultations. Now, when it comes to bone health, one of the services that you provide, which is yoga, right, can impact that. So next month, for the month of April, you have an offer regarding your yoga and meditation services.
Right. So for new clients, it's 15% off the different yoga services here. Yep. So if you're interested, you can call the clinic and they can give you the details. And it's 15% off all new yoga.
I think that's a great offer, because when it comes to one-on-one yoga sessions, if you're someone who is somewhat intimidated by being in a class setting, not sure about how you might look compared to other students taking the class, this really helps to take that out of it. Right? Yeah. And you get one-on-one personalized instruction. So again, you have some tools to take with you when you do maybe go to some classes, or you're practicing some of these techniques at home.
Yeah, and form is really important. So it's really important to get that down so you're not hurting yourself. So.
Exactly. So it's not about how flexible you are, it's about whether you're doing that movement properly.
Correct.
Right? Yep. Okay, great. So again, bone health, pay attention to the things that you eat. sum that up maybe that way.
Yeah.
And then next month, if you're interested, Alicia is offering 15% off of her yoga meditation services. So again, for the reasons that we just went over, if you're into that, you're more than welcome. So again, thanks for joining us today, and we'll see you again fairly soon to share more information.